Hi everybody, I'm Dr. Lou Walters at the Source Wellness Center. I run a number of different tests for patients in my office. Some of the testing we do is often different varieties of food testing. Now, some people come in and they're having GI symptoms that they, either get indigestion or diarrhea, constipation, gas, bloating, heartburn, nausea, and they suspect it might be something they're eating that is causing irritation, which is often the case. Some people come in and they might not even realize that it's something that they're eating causing their symptoms, whether it be skin rashes, muscle joint aches, pains, headaches, different neurological symptoms. All of this is due to the immune system. Anywhere from 55 to 80% of our immune system lines our digestive tract, depending on when it's tested. And the food we eat can cause that immune system to get overstimulated, and those symptoms may show up in the gut. They may show up somewhere else, and it doesn't have to be both. So, like I said, not everybody realizes it's the food that they're eating. There's different types of food testing. There's no shortage of different companies that you can get tested through. There are different ways that the immune system can respond to foods, and there's no one good test that measures all of them. So there's an IgE antibody test, which is a true allergy. That's where you eat a peanut or some shellfish and you swell up right away. And for most people, I don't find that's the one we need to do testing, but it's there if we do. There's IgG and IgA antibodies. These are different types of antibodies that would typically get stimulated and produced much longer after you eat. So it might be 5 to 10 days after you eat something that you get symptoms, and you might not associate the food you ate with those symptoms, which is where the testing can be helpful. There's another kind of test called a cytokine test. Cytokines are these protein signals that white blood cells will release to tell other white blood cells in the area that there's a threat. So the test will expose the patient's blood to those foods and see if there's a big response from the white blood cells. And I have seen that some people get all these tests done and nothing comes back positive, and then we do other things to try to figure out if their symptoms are related to food. And like I said, it doesn't always show up on the test, but it can be quite helpful information. So I hope you find this helpful. If you have any symptoms that you're concerned about food or just want to do some testing, you can either contact myself or another practitioner to use these tests. Hope you find that helpful. Best wishes, and be healthy.